Hi, I'm Dr. Deeptee Jain. I take care of thousands of patients who have spine care needs every single year. A common question I get asked about is minimally invasive spine surgery. So let's talk about what is minimally invasive spine surgery. There are traditional ways of approaching the spine, and then there are minimally invasive ways. So in traditional spine surgery, typically surgeons make a midline incision in the middle of the spine. In this model, that would be right here in the middle. Now, what's not shown in this model is that there are a lot of muscles here and here that surround the spine. And so in traditional open spine surgery, a midline incision is made and the muscles are elevated off of the spine in order to perform whatever work needs to be done. Minimally invasive spine surgery is a spectrum. So it means a lot of different things to a lot of different people. In my mind, what that means is preserving that muscle envelope. Doc, why do we want to preserve the muscle envelope? I'll get asked. Well, there's lots of reasons. To me, from a long-term perspective, when those muscles are elevated, we use what's called electrocautery. We essentially burn all of the blood vessels and all of the nerves off the spine. And so the advantage is that we leave that muscle envelope intact. Muscles are dynamic stabilizers of the spine. They're very important for stabilizing the spine and, in my opinion, reducing pain. Again, a lot of this is opinion. There isn't a ton of great evidence about this. The best that we can do is to retain that muscle envelope. And so in minimally invasive spine surgery, that's the goal. We try not to disrupt that muscle envelope. And there's lots of different ways to do that. So typically that means smaller incisions. It also means quicker recovery because we have not disrupted those muscles. They don't need to heal. They were never disrupted to begin with. It often means less blood loss. It means shorter, if not no, hospital stay. Spine surgery can now often be done in an outpatient setting. Minimally invasive spine surgery is awesome. So the first fundamental concept to understand is no matter if you have minimally invasive spine surgery or open spine surgery, the principles of spine surgery are the same. They're just approached in different manners. And so ultimately, what's going to determine recovery to some extent is not necessarily whether you had minimally invasive spine surgery or open spine surgery, but rather it's actually what the underlying pathology is and what the surgery was that was actually performed. So, for example, if you have a disc herniation and you undergo a microdiscectomy, that's a surgery that is not a fusion, that's a decompression-only surgery. Whether that's done minimally invasively or whether that's done open in a traditional fashion, either way, the recovery is going to be much shorter than that of a spine fusion. And in a spine fusion, we're often putting cages, rods, and screws to help the bones heal and meld together. The bone healing takes some time, and that's why that recovery time is a little bit longer. So in general, if let's say we're now talking about spine fusion, in general, minimally invasive spine surgery has a faster recovery. What does recovery mean? So taking a step back, I define recovery as actually full bone healing. And so full bone healing, the biology does not change, whether it's minimally invasive spine surgery or open spine surgery. The bone still needs to heal, and that bone can take up to a year to heal, no matter what approach you have done. However, what is really different is the muscles that remain intact in minimally invasive spine surgery versus open spine surgery. And so what does that mean for the patient? What does that mean in practice? So minimally invasive spine surgery often results in less blood loss. That's less trauma to the patient. That means that oftentimes we don't need to keep patients in the hospital because we're not monitoring their blood loss. We don't need to because we've had very minimal blood loss. So that's very exciting. Additionally, patients often have less pain. Again, because we're leaving the muscle envelope intact, those muscles are not getting disrupted. Disrupted muscles are very painful. And so again, because of this, we can often do spine fusion as an outpatient. Patients can go home as opposed to having to stay in the hospital for pain control. Let me tell you, patients much prefer to be home than they do in the hospital. I'm Dr. Deeptee Jain. If you like what you're hearing, hit the like button and also subscribe. And we deliver new information about neck and back pain every day.